This healthy living tip is brought to you by the Christ Hospital.
A chronic wound is a wound that hasn't healed with traditional treatments for over a period of 30 days. A chronic wound is typically a window to some underlying medical condition. We see a lot of patients with arterial and venous ulcers who have that underlying disease. We also see a lot of wounds in patients who have diabetes. So basically, the best way to prevent a chronic ulcer from forming in the first place is to work closely with your primary care physician and manage those types of underlying medical conditions. When we see a patient for the first time in the Wound Healing Center, we take into consideration a number of different factors, including nutrition. We also assess their arterial circulation, their venous circulation, as well as other factors such as infection that may contribute to someone's wound not healing. So when someone does come in for the first time, we have a set algorithm, if you will, that will help direct our therapy based on that particular patient. The Christ Hospital Wound Healing Center is staffed by a multidisciplinary team. So we have a number of doctors with backgrounds which include internal medicine, plastic surgery, podiatry, vascular surgery, that basically can look at the patient as a whole, come up with a game plan based on our treatment algorithms. And the great thing about the Wound Center is that we have a number of wound treatment products available at hand, which may not be available at the primary care doctor's office. Sometimes wounds have a hard time healing because the oxygen levels getting out to a wound aren't good enough. What hyperbaric oxygen therapy will contribute is basically increased oxygen levels to the wound. What we do is we place people into the hyperbaric chambers. We give them 100% oxygen at higher atmospheric pressures, and by doing so we deliver higher oxygen to the wounds. Now, not every patient is a candidate for hyperbaric oxygen therapy, so there are obviously things that we look into before we consider that type of treatment. Most patients that we treat with hyperbaric oxygen therapy have diabetic ulcers. We also see patients who have wounds that are related to other medical treatments such as radiation. Patients who have radiation treatments sometimes do develop sores, and in this situation hyperbaric oxygen therapy can help. The treatments typically take about 2 hours to do, and there is a treatment of approximately 8 weeks where our patients come in about 5 days out of a week to receive their treatments. It doesn't hurt, but the patient does have to become used to the increased atmospheric pressures. So sometimes people have problems clearing their ears, kind of like if you're diving underwater or going up into an airplane. Those types of situations apply. In the situations where we use hyperbaric oxygen therapy, we definitely see an improvement in wound healing. I think the Christ Hospital Wound Center is an excellent place for our patients to come who have chronic non-healing wounds. The reason is we have a multidisciplinary team who evaluates the patient on a week-to-week basis. We also have the equipment available to help these patients get their wounds healed in a 16-week time frame. That's our goal.
For more information or to schedule an appointment, call 585-4595.